That Saturday, Nick woke up and he just didn't feel right. He's usually a very energetic kid. He laughs and plays and jumps around, and he just didn't feel good. He usually eats a ton for breakfast, and he really didn't want to eat any breakfast at all, and he said his belly hurt. So, most parents, they just want to make sure they try to feel better, so you did everything that you could, go to the bathroom and lay down and this and that, and nothing was getting better. Just nothing was getting better, and he wasn't throwing up, and didn't have a fever, so we just kind of watched him during the day, and later on in the evening things got progressively worse, and the bellyache was not getting any better, and that's just not like Nick at all. He doesn't like to be down. He likes to be up and around. As his symptoms started getting kind of worse, we decided to take him over to the Nationwide Children's Urgent Care, and at that point Dr. Rich examined him, brought him in, and decided to do some x-rays. When Dr. Rich examined him, he was very, very tender on his belly, and it's just not like a 6-year-old to necessarily be like that with some belly pain. Usually they're up and they're down, or it hurts and then it goes away, but with Nick, he just wasn't moving and was just in very much a lot of pain and not laughing and not being the Nick that we know at all. So at that point, Dr. Rich decided to send us down to the Nationwide Children's Hospital for some further testing. We got down to the hospital right away as they told us to. Nick was still feeling really awful. As soon as we got there, we already had our transfer papers, so everything just moved flawlessly. They brought us right into the triage room, examined us, brought us into our emergency care room, and at that point, the physicians and the nurses got everything rolling very fast with IVs and lab work and different tests set up. Our diagnosis was, very crazily, pancreatitis. Who thinks that a 6-year-old is going to get pancreatitis? The gastroenterology team decided to send us for some more testing, and through the results of an MRI on Nick, they came to find out that he had a disease process that he was probably born with on his biliary system and gallbladder. So they decided to talk to the surgical team at that point and decide what to do for that. I work in radiology, so when you come in with a child who has symptoms of something that you know what it could be, it's very difficult stopping yourself from being a medical worker to being a mom. All the tests that we went through at the hospital, I know all the tests and I know all the disease processes, so it is a very, very frightening experience for any parent, let alone a medical worker parent who knows what could happen or what might happen or what sometimes you don't want to happen. On a Friday, we went in and Nick had a surgery to take out his gallbladder and reroute some things in his belly, and he came out of surgery just fine, and we went home a week later. We were just so lucky that all the people involved, from the urgent care to the gastroenterologist to the surgical team to all the doctors and nurses at Children's, those people are very, very good at what they do, and we are so lucky that we have a #1 children's hospital here in the state of Ohio. Nick is great. He's back to playing. He's doing everything he wants to. He's playing the Wii and doing his Legos and jumping and riding his bike and back to school, and he's exactly the Nick that we knew before everything happened at the hospital.